Video 3. Lumbar Puncture. Position the patient supine on her side with her chin down and knees to her chest. Keep the back as perpendicular to the bed as possible. Locate the top of the iliac crest. The area between L4 and L5 spinal processes should be at the same level as the iliac crest. This is the ideal location to insert your spinal needle. Open up your lumbar puncture tray. Use the betadine solution to prep the area. Make sure a chuck is placed underneath to keep the area clean. Put on your sterile gloves. Apply the sterile drape included in your LP kit. Place the additional sterile drape as shown to increase your sterile work area. Open the lidocaine bottle supplied in the LP kit and aspirate the solution into the small 5cc syringe. After sterilizing and draping the area, re-examine your landmarks to find the L4-L5 space along the spine. Use a plastic needle covering to make an indentation in the skin to help you. Inject lidocaine into the skin, creating a skin wheel as shown. Inject more lidocaine along the track that you will be taking with the spinal needle. The needle should point at roughly 30 degrees towards the umbilicus. Make sure to aspirate as you advance the needle. In your LP kit, set up your manometer. This will be used to measure the opening pressure. Connect both tubes together. Add the three-way stopcock. When the arrow points to a port, that port is locked off and CSF fluid cannot flow through. Set up your 4 different collection tubes. These tubes will be filled with CSF and should be sent off for further studies. The tube numbers are included on the vials. Using your spinal needle with stylet, make sure the bevel is facing up. The needle should enter horizontally, perpendicular to the back. The needle should angle towards the umbilicus at approximately 30 degrees. As you advance the needle into the L4-L5 space, feel for resistance. If you hit something hard like a rock, you are likely hitting bone. Pull the needle out and redirect. If you hit a structure not as hard, you are likely going through ligaments. As you push the needle in, remove the stylet completely every few millimeters to see if CSF comes out. When spinal fluid starts flowing, hold the spinal needle in place and attach the manometer to measure the opening pressure. Keep the white stopcock in the horizontal position facing away from the patient. In this patient, the opening pressure was between 20 and 21. Point the white arrow stopcock down, and the CSF and the manometer will dump into your vial. Make sure to fill up your vials in order as marked 1 through 4. In the first 3 vials, fill up at least 2 cc's each of CSF. In the 4th vial, fill up as much CSF as possible. Remove the manometer and place back the stylet. After the stylet is pushed in all the way, you can remove the needle. Place a bandage over the site for minor bleeding. Congratulations, you have completed a lumbar puncture.